investigation the difficult airway lateral maximal extension lateral view maximal extension في rheumatoid arthritis patient في anticipating difficult airway يعني clinical with my eye ان انا اسال البيشنت يعمل كده دي كان abolish ان انا اطلب lateral x-ray على الcervical spine.
If he can extend his neck for more than 90 or for 90 degrees, 90 flexion and 90 extension, then you should expect that intubation will be easy. If less, then you have to make a lateral X-ray for the cervical spine.
Well, discussion is open for both lecturers.
سؤال دكتور عبيد بس في الايس انهبيتورز يوجوالي كان بيبقى مكتوب ان انا مش بعمل مش بكونتينيو الايس انهبيتورز في الداي اوف سيرجري عشان بتعمل انترا اوبراتيف هايبوتنشن بس دلوقتي الدكتوره عبير قالت لنا ان هو وي كان كونتينيو الايس انهبيتورز برضه الاسبرين with holding 7 days before يعني مش I'm not understanding الادفانتج بتاع with holding aspirin 7 days.
Regarding your first part, the ACE inhibitor, we have not sharp guideline regarding the use of perioperative ACE inhibitor, but according to the recommendation of the American College of Surgeons, American Heart Association, there is consideration about the hypotensive episode that may occur during induction of anesthesia. So they said that if the patient is on ACE inhibitor, he must continue. If he stopped or abruptly, if he held the medication a few days before, he must resume the medication immediately post-operative when it is feasible. Feasible or clinically feasible mean that when the patient is hemodynamically stable, there is no hypotension, there is no bleeding. Regarding the aspirin, according to the recommendation, we said aspirin may be given as primary prevention in case of patients who are at risk of thromboembolic issues like old age, female patients, obese. In these conditions, we may stop aspirin 2 to 7 days before surgery. Why 2 to 7 days? Because aspirin causes irreversible inhibition of the COX inhibition irreversibly prevent the production of thromboxane E2. That's why we have to wait till production of new platelets to carry the function. And this is unlike non-steroidal anti-inflammatory drugs that may be interrupted 1 to 2 days before surgery because the action of non-steroidal anti-inflammatory drugs, unlike aspirin, are reversible. So we can resume the function of already existing platelets in the circulation. 2 to 7 days is the duration required to sensitize new platelets.
Excuse me, Dr. Abir. As regards not the use of non-steroidal anti-inflammatory drugs, I believe 24 hours is just enough for stoppage before anyone attends for regional anesthesia. As regards aspirin, I think 2 days is too little. Either you stop it for 7 to 14 days or 7 to 10 days, but 2 days is quite a very small interval to recreate again the enzymes. So I think that 2 days is too little. One more thing, as regards the use of steroids, we don't know exactly when the suprarenal is back to normal function. This means that any patient on steroids, we don't know exactly when his suprarenals are back again to function. And therefore, the use of steroids is depending on the extent and magnitude of the operation. I mean, for abdominal operations with the maximum stress, the body needs approximately 500 milligrams steroids a day, hydrocortisone. So with the dosage you mentioned here, as regards 25 milligrams at induction and then 100, I believe that this is too short dosage for a major operation. I myself, I do in my private practice, I give at least 300 milligrams for the first 24 hours, and then I taper the dose over the post-operative period. One final thing as regards the use of non-steroidal anti-inflammatory, the low molecular weight heparin. This depends on depends on the dose. Either it's prophylactic or therapeutic. For prophylactic, it's just 0.5 milligram per kilogram per day, and then I can attempt regional anesthesia safely 12 hours after stopping. For the therapeutic dosage, which is 1 to 1.5 milligram per kilogram, depending, you either give it as one shot or two equal divided doses, at least 24 hours have to lapse before attempting any regional anesthesia. Thank you.
Thank you. Thank you for your good recommendations regarding the three items you've mentioned. Regarding the first one about the, it was about the use aspirin. There is no difference. We've said that from 2 to 7 days. If after 2 days the platelets will start to be, new platelets will appear in the circulation. So according to the urgency of the procedure, we may proceed. So we have time interval. But I agree with you, if it is possible to delay the surgery for further time, this will be more beneficial to the patient. This is number one. Regarding the steroid therapy, it was used to use about 300 milligram per day, considering that the daily production of the cortisol in our body is 30 milligram per day. And in cases of surgical procedure, which is a stressful situation, the production or the requirement is increased to be 300. That was thought before, but the recent guidelines are recommending new way for managing the steroid, depending on the majority of the surgical procedures. And it is not only giving the patient intraoperative steroid. No, we have to continue in his preoperative steroid therapy till the day of the surgery. And according to the magnitude of the procedure, if it is minor, they recommended no need for covering, and you have to follow the patient clinical hemodynamics and clinically post-operative if he is in need. In case of minor procedure, the patient must continue in the preoperative medication till the day of the surgery, and intraoperative it is enough to give 25 milligram per induction and 100 milligram for 24 hours for 1 day post-operative, resuming his usual steroid medication immediately when he starts oral feeding. And in case of major surgery, we extended the steroids to be 100 milligram per day for 48 days to 72 days. These are the new recommendations regarding the use of steroid therapy. So giving 300 is no more recommended anymore. It depends on the type of the surgery, and considering that the patient is continuing on his regular steroid therapy in the preoperative period and immediately post-operative.